My name is Shawn Needham. I am with Sickened, How the Government Ruined Healthcare and How to Fix It. And James here is from New Health, and he has a great story about some of the innovative ways that we can get away from traditional health insurance. So welcome, James. And
glad to be here, Shawn. Thank you for having me.
Let's go ahead and get started. So my first question is, James, what's the personal story or the personal reason for starting New Health? How did that idea come about?
Yeah, so I grew up in the UK, and so I never had any need for health insurance. But when I moved to America in 2005, and for the first 8 years that I lived in America, I didn't have health insurance. I was an independent contractor. I started my own business, and so I was young, and I was just kind of taking a chance, and also because it was really expensive. And then in 2013, I had a daughter, I had a child. And at that point, I sort of decided, okay, we really need to do it. In fact, my mother-in-law said, we're going to have to get health insurance now. So I started looking out and I started looking at all the options. And, what I saw was that health insurance, the way that it was created in America, was not insurance as you classically think about it. It was a whole health plan. And, I'd been involved in integrated medicine for a long time, and the kind of doctors that I would choose to see for myself and my family, didn't take insurance. And so it got me thinking, is there a different way? And at that time, I came across some of the Christian health cost-sharing ministries, which were a super interesting American concept where church groups had created their own health cost-sharing community, where essentially groups of people would come together who all felt the same way about healthcare and would agree to take care of each other. So rather than having a company, an insurance company, take care of you and take care of the risk of something bad happening, the community took care of it. And that really appealed to me because I'd grown up in community. And so ultimately I joined that group, and there were things about it that I liked. It was way cheaper than health insurance, about 70% less. For me, it was, instead of I think $1,500 a month, it was $500 a month. So I was saving a significant amount of money. They had some good ideas, but I just felt like it wasn't quite reaching its potential of what it could be, because my career has been all about furthering the delivery of integrated medicine. And I know that that if you take care of your health, if you participate in your health, and if you care about health, you can reduce the chances of you ever needing to go to the doctor, especially for a lifestyle-driven chronic illness. So, in the years after that, in 2014, 15, 16, my show, the Functional Forum, took off. We became the world's largest integrated medicine conference. We started really looking at how can we deliver integrative medicine, functional medicine in an affordable and sophisticated way. And, once we built that practitioner network and so forth, I thought to myself, if ever there was a chance for us to be able to create a medical cost-sharing community that wasn't built just on religion, but built on the idea of health creation, then we should take that opportunity. And then in 2018, January 2nd, the Trump tax bill went through, and there were a lot of changes that happened there. But the significant change that I noticed was that the thing that had made the Christian health cost-sharing ministries really popular, which was their exemption to Obamacare, sort of became null and void, because that the individual mandate went away. And that was when I decided, okay, we're going to start our own medical cost sharing program, and we're going to take the principles that made it very successful in the Christian world and just try and create something that's actually transformative for healthcare, using those principles and adding in some of the ideas that I'd seen be effective over the last few years.
I see. So tell us, explain to us what integrative medicine or functional medicine, I think you've used those terms. Explain to us what that is.
Yeah. So, medicine as we now see it, so Western medicine was created in an era where the majority of disease was acute issues. So acute infections, trauma, those kind of issues. So the most effective type of medicine was, drugs or surgery to work out, you've got a significant acute problem, a drug solves that problem. And it's, that's a reasonable way. That's the best way of doing medicine. Then over the last 40 years, what you saw is that the kinds of diseases that we were facing changed dramatically, not just a little bit, dramatically. So, in the US, we now see that the biggest killers are heart disease, type 2 diabetes, autoimmune diseases. And that took about 40 or 50 years to happen in America. But in other countries around the world, it's happening even more quickly. In South Africa, where my dad lives, that change happened in 10 years. So you have diseases that are completely different in their etiology, where they come from, in how they affect the body and what causes them. And ultimately, what I started to realize was that for those diseases, the drug first model was not really working. If you take a drug for an autoimmune disease, for instance, there's not really like a plan to get back to health, right? You're kind of poisoning the body a little bit here and there to stay, to reduce symptoms, but the goal isn't like a healthy homeostatic body. And so ultimately, I realized that because I had grown up in a world where people, thought about health differently. And that's when I came across, the growth of integrative and functional medicine. So, the words I use a little bit interchangeably. There are subtle differences between them. But ultimately what you're looking at is a type of medicine where, one, the patient participates in their care. Right. So the patient is a responsible member of the team. In Western medicine, the doctor is the hero. In integrated medicine, the patient is the hero. They're really participating in their care. The second thing is a root cause approach. So in that example I gave with autoimmune disease, is the goal to just hold off symptoms as long as possible? Or is there a way that we can actually get the body back to full health? And so getting to the root cause of what's causing the body to attack itself and dealing with that root cause, it is very possible to reverse autoimmune disease. And then the third thing is a sort of a holistic viewpoint. So, most chronic illness happens not in one organ, but in multiple systems and organs as they interact. So we really need to take a whole person approach. So those three things are sort of like the fundamentals of the difference between conventional medicine and functional integrated medicine. The difference between the two, integrative is sort of like a catch-all umbrella term for any way that you integrate standard of care medicine with non-standard of care medicine. Functional medicine is a very specific operating system for integrated medicine that prioritizes the different things that you would do. But if you're doing integrative and functional medicine, expect to focus on sleeping well. Food as medicine is a big part. Stress and relaxation is a big part. And then, many people will take supplements or other things to help with bringing the body back to homeostatic health.
So you mentioned that the patient in this type of medicine, the patient is in charge of their own health, not necessarily the doctor. So can you speak on how, does the patient has skin in the game. So how does that help their health? Is that kind of where you're going with this?
Yeah, look, type 2 diabetes is a great example because it's just the most obvious one, right? So if you eat McDonald's every day for 10 years, you'll probably get type 2 diabetes, right? That much sugar, that much salt and fat, over time, it's not going to give you diabetes on day one. But if you do it over 10 years, there's going to be a breakdown of the physiological processes. The insulin handling that process will break down and you'll probably end up with diabetes. So in that case, yes, you can take metformin for the rest of your life to monitor your blood sugar. But ultimately, what if you just started eating an anti-inflammatory diet without so much salt, sugar, and fat? Could you actually reverse that process? Could you, get your insulin sensitivity to come back on board? And the truth is, yes, you can. And there's tens of thousands of examples of this happening. And ultimately that's kind of the difference. So in that case, the patient would have to eat differently. They'd have to take care of their stress. They'd have to, participate in their care. The patient on metformin just have to take their metformin every day, and it's probably easier. But ultimately, the other one is much more rewarding because you get to live a much more active life, and you're not just sort of waiting for the next disease to kick in, which is caused by taking metformin for 10 years. So ultimately, it's about what is the goal of of the intervention. And in integrated medicine, the goal is homeostasis. In Western medicine, the goal is reduction of symptoms.
So how does New Health fit into this functional medicine, integrated medicine?
Yeah, so ultimately, what I was looking for is that, the problem with functional integrated medicine right now is that it's typically only done when people have used every other type of medicine, right? So, let's say, you've tried everything else, it's not getting better, there's a limitation on what's provided, and then you would go to, try something, outside of the standard of care last. And what I saw was that what causes that is your insurance program, right? If you have your insurance, typically you'll have a doctor or a network, and you go to that primary care doctor, and that primary care doctor is the gateway to conventional medicine, specialists, specialized drugs, specialized surgeries. That's the system. And so ultimately, what I saw that we need is if we could put this type of health at the front, proactive, personalized, participatory health at the front of medicine, we would be able to keep people healthy and reduce costs. And so ultimately, you could try, there are companies out there where they just sell this integrative functional medicine to patients for cash outside of their health plan. But I thought, look, if we really want to go for the jugular, if we really want to transform healthcare, we need to create an alternative to health insurance where integrated medicine is the standard of care, where people choose that as the first call and keep themselves well and don't go down a path of, multiple drugs and getting sick. So ultimately, how do we get people to buy into that, right? So, because still most of the population aren't really aware of integrative and functional medicine. Well, the thing about cost sharing is it's way cheaper than insurance. So I thought if we could just create something where health insurance, where we have an alternative that's much cheaper, where we can bring people in because it's cheaper, and then expose them to integrated medicine concepts, health creation, health coaching, the things that we provide there, then we would give especially young people a chance to kind of avoid getting into the healthcare system altogether. Because once you're in, it's kind of hard to get out. And so that was the purpose of New Health, is could we create a way to make it easy for people to get integrated medicine first?
So can you explain how that works as far as monthly, monthly, I know they're not called premiums because it's not insurance, but monthly premiums, and how does New Health work at the doctor's office? Is it like traditional insurance, or that gets paid? Does this functional medicine stuff get paid for, or explain how that works?
Yeah, so cost sharing generally, the reason why it's made way cheaper is because we don't build in all the cost of all of the drugs and everything into the plan. So ultimately, medical cost sharing is really designed to help in the case of a medical necessity. So you have a new diagnosis, you have an accident, any kind of medical thing happens, you can choose whatever providers you want. If you love your doctor, you can go to your doctor. If you need a specialist, you can call up New Health and say, hey, I'm having this thing. Where should I go? We've got a whole team with 20 years experience at helping people find high quality providers where they can pay cash. And the biggest thing that keeps the cost low for everyone is, friends don't let friends pay retail for medicine. One of the sort of like things why health insurance is so high is that they're already paying these like super inflated rates for doctor's visits, for surgeries, for lab testing. That's built into the insurance system, and that's why everyone's sort of getting paid through the system. Ultimately, what health cost sharing is a group of self-pay patients coming up with their own agreement about how they will share those costs in the case of an emergency. So, many of our people in New Health, they love their doctor, and maybe they go once or twice a year to their doctor. They pay cash rates, and they just pay that. If anything happens, excuse me, if anything happens, you have an accident or otherwise, you go, you call our team, they'll negotiate the rates, you pay those, and then subject to the relationship in the agreement in the company, you would be paid back. Let me give you an example. So, A friend of mine, Katie Wells, I was on her podcast the other day. Last year, her husband had appendicitis and needed to have an appendectomy. So that surgery would have cost $132,000 if it had been charged to insurance. Because they were part of the health cost sharing ministry, they were able to negotiate that and pay cash. They were able to pay that group $12,000 instead. So already they've saved $120,000 for their community. And then their agreement meant that they had to pay the first $1,500. So they paid the first $12,000, or they got on a payment plan for it, and they paid $12,000, and then the community paid them back $10,500. So their total out of pocket for that whole thing, excuse me, was $1,500, and that's the agreement of the community they were part of. The community paid the other $10,500. But the reason why health cost sharing is so much cheaper is that no one paid the $132,000. And that's the sort of center of the scam, if you will, is that all the prices are inflated because no one knows what anything costs. And it's all very obscure and opaque. And that's why health insurance is so expensive. And that's, why we're doing something about it. You have to pay the lowest possible rates, and that's cash.
So this is what you're telling me. This is almost unbelievable, although I've heard stories like this. But you're telling me a payment from $130,000 to $12,000 just because the person negotiated a cash price.
This is happening all day, every day in healthcare. The most egregious example for me is lab cost testing, where literally if you're in one of the 47 states outside of New York, New Jersey, and Rhode Island, where it's illegal, but in every other state, you can go directly to the lab. You don't have to go through the whole system. And so we've seen, people getting billed for lab tests for $700, where literally the same test would cost $17 if you go directly. So the markup there is extraordinary. So why would you ever pay that amount? Just go straight to the lab. And so we help our members never pay over the very lowest cost, because it's literally the same lab doing that thing. It's not like it's a better lab doing the other one. It's the same scientists, same thing, Quest and LabCorp. So this is happening all the way through the system.
So basically what you're telling me is insurance companies are scamming. It's a scam. It's a ripoff.
That's the way I see it. And ultimately also they're pushing you towards the most expensive interventions, which are drugs and surgery. Learning to meditate costs almost nothing. Learning to do yoga costs almost nothing. Eating healthier food does cost a little bit, but ultimately the cost savings down the road compared to other food are there. So, the system is set up to create sick humans, because sick humans are very profitable. New health is, we called it new health because when people say it, I want them to think, okay, this is just the new way that we're going to do things. There's that confidence that this is the way it is. But it's new with a K because we always knew, right? We just forgot. This is how communities have taken care of each other for millennia. Grandma knew best. We had people taking care of themselves. If you look at the healthiest places in the world, in the blue zones, in the places around the world that have the highest life expectancy and the lowest rates of chronic disease, do they have epic hospitals down the road? No, they just have healthy behaviors that are inbuilt into the culture. And so we have to create a new culture. And you can't just transform the culture of 300 million people or 350 million people in a day. You have to start somewhere. And so we're building this cost-sharing community as a new culture where people take care of themselves and take care of each other.
Wow, that is great. I'm so excited for you about doing this. So how does this work into these cash prices versus these insurance prices? How would you say that works into the free market? And does the free market have anything to play with that?
It is the free market. Basically, the only reason why you have these incredible prices happening is because of this kind of collusion between companies and also between companies and government. Ultimately, the free market is, if you just paid free market prices, if you were paid cash directly, the reason why these prices are so high is because they know they're not going to pay, and they're going to, there's going to be a negotiation or otherwise. And it's like the insurance companies and the providers all having this sort of dance that started in the 1970s and is good for both of them, but bad for us. So, the beauty of the free market is that now you're starting to see more and more doctors and providers leaving the system altogether and only charging cash rates. So you've seen the growth of direct primary care, where instead of having an insurance plan and paying your doctor and going in and giving your insurance card, your doctor will just say, for $80 a month, I'll be your doctor. You pay me directly. We don't have to wait anything with your health insurance. And if you need anything, just come in. So that's the free market showing that, that it works better. That's better for patients and it's better for the doctors. It's not as good for everyone else in the hierarchy, but, that's just really thinking about who's really important in healthcare, right? The patients are important, the people, the healthy people and healthy communities. And it's important for the doctors too, because we need good doctors that aren't stressed, aren't dealing with a million paperworks and having to, learn a million ICD codes to, be in practice, but are just doing the best by their patients. So ultimately what the free market does is, bring down costs and increase quality and choices. If you look at insurance too, insurance is only available, only very few providers in each state. It's kind of like a oligopoly kind of situation. And so, New Health is available in every state and people can join our community. They'll only pay the lowest cost for any things that they need. And if they don't need anything because they're healthy, because they take care of themselves, they're only going to paying a small amount. It works very similar to insurance. You pay in a certain amount every month. That's the the unshared, that's the share amount. So it's kind of like a premium. And then there's a certain amount that, that you would have to pay before you get paid back. It's similar to a deductible. That's called the unshared amount. So it's very similar. It's just the numbers are a lot lower.
So one of the questions we commonly hear about either insurance or, sharing programs is we hear about pre-existing conditions. So how does New Health handle pre-existing conditions?
Yeah, so, we're a startup, right? We're not a government agency. We're not funded by other people. We're a startup. And so ultimately, what we're looking to do first and foremost is to build a community of healthy people. So the way that we've created it that is most fair is that we will accept anyone. You can come in, anyone, as long as you're under 65. We can't work with anyone over 65 because then Medicare is the default payer. But ultimately, anyone could come in. And the way that we have it set up is that if you have a pre-existing condition, the costs associated with that pre-existing condition are not shareable in year one. They're shareable in year two, up to $25,000, up to $50,000 in year three, and after year four, they're completely shared. So, we have a lot of people that come into our community who have managed to reverse their chronic illness through lifestyle. And so ultimately, if that's going well and they're off their medication, it's just really, if you're the kind of person, if you're a person who pays $800 a month in insurance, but all of their medication costs $6,000 a month, we can't really have you in our cost sharing program because we'll be dead out of the water. And so over time, we're going to bet on ourselves to be able to reverse chronic illness. But as we're just getting started, that's what we come up with.
So let me just kind of summarize if I heard this right. So you're basically saying that a lot of chronic illness might be able to be changed with lifestyle changes. And then if that's the case, the patient would actually be on a lot less medication, need a lot less medical care, and ultimately be a lot healthier. Is that kind of what you're saying?
Yeah, we have to make the incentives work, right? In the current system, the incentives, the people that get the most value out of their health plan are the sickest. And so running in the background is a disincentive to be healthy. In our system, all the incentives work in the right direction. The incentives are to be healthy and to stay out of the system and, just to do whatever you need to do in order to maintain health. But typically that's not medical, right? The way that people stay healthy is to, exercise and eat right and take care of their stress and those kind of things. Like, you're going to get hit you might get in a car accident and you might not. The chances of that happening, whether you eat well or not, are about the same. You want to have reassurance that at that moment, if something happens to you, that you are able to, that you are taken care of. But ultimately, you want that in order to create what I'm here to do is to create a system that keeps people healthy and controls healthcare costs, because those are the things that we have not worked out how to do as a country and as a race. And ultimately, that needs the right kind of care, right? If there's an emergency, we need emergency care. If it's just regular living, we need creating healthy behaviors. We need to model after the blue zones. And ultimately, what that is having healthy behaviors being part of the culture. And so ultimately, that's what we're building, is a culture where people can come, be part of it. They're going to learn healthy behaviors. They're going to get massive discounts on lab testing. They're going to have access to health coaches who can help them. Health coaches can't prescribe. So the only tools in a health coach's box are, how are you sleeping? How are you exercising? How are you taking care of your stress? So those are the people on the front line in our community. And ultimately, they cost a lot less than doctors too. So it's about helping all of our members have a plan to take care of themselves. And if something, bad arises or happens, or you get a, new diagnosis, that the community is there to share in those costs.
Wow. So it's not that New Health doesn't accept people with chronic conditions. It's just that those patients have skin in the game, and they have an incentive when they join New Health to get healthier by making lifestyle choices, correct?
Yeah, absolutely. And so we have a lot of people like in our functional medicine network, right? So let's say they're paying health insurance and they're paying $2,000 a month for their family, and they see, oh, wow, if I could get off my metformin, I'm now taking metformin for my type 2 diabetes. But if I could get off that, I could, it would be really awesome for me to join New Health at $600 a month for my family. I could save $1,400 a month. So look at that incentive. You created an incentive like for someone for $1,400 a month in saving to, eat right and exercise and do those kind of things. That's a big incentive. That's $18,000 a year. And so ultimately that's what we've created as a starting point. And it's exciting. The most exciting thing, Shawn, is seeing people who have just been working in a job they hate for decades just for the healthcare. And now they realize, because they know that if they leave, they're going to have to pay the full amount. Same thing, $2,000 a month for their family. Now they think, oh, if I could just get New Health, maybe I could take a shot at having my own business. Maybe I could work for myself. Maybe I could work from home to spend more time with my kids. Those kind of stories are the most inspiring, because that's a real life-changing moment.
That is. I love stories like that, and there are so many of those. I think it can be very liberating to patients when you let them know that they're in charge of their health and they're ultimately responsible for it, and they can make those changes and get healthier. So what do you see as the future of insurance healthcare versus these health sharing models?
Well, look, it's not going to die anytime soon. The system is very inbuilt, but I do see in more and more companies are looking at outside of insurance. Like once a company gets to 10,000 employees or 5,000 or even less, they go self-employed. Self-insured. They don't need an insurance company to manage their risk, because they're big enough to manage their own risk. And so, and also we see more and more people on an individual level moving into freelancing or the gig economy and getting out of jobs that have health insurance packaged into it. So, I think that over the next 20 years and particularly over the next 10, I hope that what we can show is that when the right incentives and the right care are delivered, we can control costs and keep people healthy. And the projects that I'm involved with, yes, New Health is an alternative to health insurance, but, I'm working with teams that are also reversing autoimmune disease for employers, as an example, right? So if you have an employee that is taking, Humira, costs $5,000 a month, $60,000 a year, the average cost of care with someone from autoimmune disease, $100,000. What if you could get people off that, off that medication and better? So they're doing that over there. So there are groups taking on all of these different challenges. My own viewpoint is that very soon you'll see that the first person that you see in healthcare will not be a prescriber. because I feel like that is it's likely that most people just need a health coach. They don't need a doctor. If you have an acute situation, you need a doctor. And I think we'll see that will start to make not just clinical sense, but economic sense. And therefore you'll see the widespread adoption of things like health coaches, group medical visits, and education on healthy behaviors.
Wow. Yeah. Well, that's definitely a subject we could, have for another conversation, because we could talk a lot about that. Because one of the things is that, the industry, what the health insurance industry has created is basically that they've created an industry where, doctors are in charge of quote unquote health. But really, is there medical issues involved in all this? If really all they need is to make some lifestyle choices, do you need a doctor that went to school for 8+ years to make those decisions? And so, yeah, I totally agree with you on that.
Yeah, look, there's this army of like nutritionists, health coaches, dietitians who have seen the light, who are there and really want to get involved and want to help. So we just have to like get the right people in the right seats on the bus. We have a huge primary care shortage in America. So how are we going to make that up? We're just going to train, more people and try and make it up that way, or maybe start think about, who should be at the front end of medicine. And ultimately, it's not just me who thinks this. Like a lot of think tanks around the world are really thinking about, 30-year trajectory in health, seeing the rise of chronic disease and saying, okay, it makes sense to have two separate systems, acute disease and chronic disease. The causes are different. The way back is different. We need to separate these two things out. And for acute disease, we've got a great system. We've worked that out already. And for chronic disease, we needed a lifestyle first approach. But typically that's going to be delivered by either a different type of practitioner, like a health coach or a nutritionist or, patient advocate or a PA, or it's going to be done in a different format, like a group medical visit. And group visits are what I'm really excited about. And I have a book coming out in January about group medical visits because I think it's the future.
Yeah, I think you can. I think not only can you save some costs, but I think patients can be more compliant when there's a group of like-minded patients in the same, that have the same diagnosis and the same issues, so they can work together and talk about those issues. So, in closing, James, thank you for your time today. In closing, are there any final words that you would like to say, you'd like people to know about New Health? Any misconceptions that you'd like to clear up? Or what are the final words you'd like to mention about New Health?
No, I just like to say, look at the way that the food industry changed, right? When I moved to Georgia, I moved to America, I lived in Georgia in 2005. And the the food industry didn't change because there was some government regulation that says everyone must eat organic, right? People just started to realize that organic was better for them, started purchasing it. And then suddenly, when I first moved to Georgia, like rural Georgia, in our supermarket, there was no organic food. In that same supermarket today, even 5 years ago, it only took 10 years, half of it is organic. Costco, half of it's organic. Why? Or mainly organic. Why? Because people demanded it and they spent their dollars and they chose to use their dollars on things that they valued. Most people don't think they have a choice in healthcare. And ultimately they do. And so what I would say to people is vote with your dollars, because that's the biggest thing that makes a change. If we get hundreds of thousands of people who sign up for New Health and they're all leaving health insurance companies, changes are coming. And that's it's all possible for us. Initiative can't be given. It can only be taken. And so I would say, if you believe in this kind of healthcare future, start betting on it with your dollars and come and join us. Come to New Health, check out the cost calculator, see how much less it is than your current insurance. And if it makes sense, come and join us.
Well, and there again with the organic food industry, that's just a great example of the free market working, right? That really is. So I'd like to thank you, James, for your time today.
Thanks, Shawn.
And remind people to go check out New Health. It's a great example of a way that is something that is changing the way healthcare can be delivered. So until next time, we'll talk to you later.
Thanks so much, Shawn. Appreciate the opportunity.
Bye-bye.